So today we're going to talk about our next topic, which is going to be limb swelling. This is something that I see really frequently in the office. I see about 100 people a week in the office. And the reason I think I see a lot of it is it's such a prevalent problem and nobody really wants to deal with it. There's vascular surgeons I know who will limit the number of swelling patients that they'll see to maybe 1 or 2 a week. But really, this is such a ubiquitous problem and nobody wants to deal with it because it's not as if swelling issues are limb threatening or life threatening, but in terms of patient discomfort and curiosity and really kind of quality of life, it really does affect their daily living. And so I've kind of taken a special interest in swelling issues, and it's really a complicated problem. There's lots of nuances to it, and what I'm going to do today is just talk about some of the things that can cause these problems, and then I'll do further videos in depth about what I see as the most common sources of this problem. And so when I see patients with limb swelling, I usually have to go through the history and physical examination. How long have your symptoms been there? Can you relate it to anything in particular that caused it? Is there a family history of swelling issues? In women, pregnancy history is very important for reasons that I'll get into, but how many children have you had? Were your pregnancies complicated? Did you have a lot of limb swelling during your pregnancies? And did your swelling get better? So family history is important. Occupational history is very important. Are you in a profession where you stand all day? Do you sit all day? I think this whole issue, standing desks, in terms of swelling, really doesn't make a whole bunch of sense physiologically. I'm not saying that standing desks don't maybe make your legs feel better, but in terms of physiology, it doesn't make a whole bunch of sense. Whether you're sitting or standing, you tend to swell. And then exercising history. Are you exercising regularly? How's your weight doing? Have you had hormonal checkups? Have you made sure that your thyroid hormone level is adequate? So there's a whole bunch of different things that go into the history. And then the physical examination is, pitting edema. Pitting edema means I push my thumb into your leg and it swells and it doesn't, it creates a mark in it and doesn't bounce back very easily. Where is the swelling? Does it extend above your knee joint or is it all isolated below the knee? The physics of swelling is that the lower down you go, the more you tend to swell. That's why the foot and ankle swell more than the calf area. But if the swelling extends above the knee, then you're thinking there's a different etiology to this condition. So the history and physical examination is an integral part of evaluation of patients with limb swelling issues. And here, by limb swelling, I'm really referring more to the lower extremity issues. And so, and then part of that is the medication too. Certain medications can really cause limb swelling issues. So it's important to get a complete history of the medication. And I'll kind of specifically touch on that later on. But essentially, the history and physical examination gives you a large amount of clues as to why somebody's having leg swelling issues. And then part of the examination is noting the skin changes that can occur with chronic limb swelling. Like sometimes you'll see a brownish discoloration of the skin. I'm sure you've seen that, like if you walk into a grocery store and it's the curse of being a vascular surgeon. You walk into a grocery store, you start noticing these things all the time. So you start noticing discoloration of the skin, you notice varicose veins, enlarged varicosities. And so there's a whole spectrum of physical examination changes that occur that'll start off with just minimal swelling to significant swelling to varicose veins, skin discoloration, and sometimes ulceration of the skin, leaking fluid from the skin, and wounds that are difficult to heal. So examination is also a critical component of this whole evaluation. And then once you complete that, then you start really kind of honing in on the mechanisms for the swelling issues. And so, for example, if I see somebody who's relatively thin and in good shape, and they are taking blood pressure medicines, specifically a medication called amlodipine or nifedipine, less frequently SE, but amlodipine tends to cause limb swelling. Now, at a dose of 5 milligrams a day, it's much less likely to cause limb swelling issues, but if that dose is increased to 10 milligrams a day, then the likelihood of limb swelling increases substantially. So if you're on amlodipine and you're taking 10 milligrams a day of amlodipine and your leg starts swelling all of a sudden, it tends to be symmetrical too with these medications in both legs. So if you notice that your leg is swelling, think, especially if it's both legs, think amlodipine, especially if you take a 10 milligram dose. Again, 5 milligram dose is much less likely to do it, but a 10 milligram dose certainly can do it. Now, I'll kind of get into depth with medications that can cause limb swelling issues. So there's clues in history and physical examination that are important. But if I'm thinking that it's another issue that's causing it, then we start looking at more non-invasive evaluations of the condition. And so if I'm concerned about a vein problem causing the swelling, then we'll progress to venous Doppler to evaluate the veins. Now, we're not looking really for deep venous thrombosis or blood clots in the deep veins, although sometimes we're surprised to find them. We're looking really for valvular function. So there's one-way valves in veins that prevent blood from coming back down again, and they get disrupted really easily. I have the same problem from standing all my career. So I have valvular problems in my veins, and I tend to swell and ache at the end of the day. And so a valvular interrogation with duplex scanning is really important. It's a very simple test. You just put jelly on the legs and look with an ultrasound probe and evaluate the valvular function. So if I'm thinking venous reflux problems or vein valve problems, then I'm getting a Doppler. If I see swelling above the knee, I'm thinking of different issues that may potentially cause it, and I'll kind of get more into that when I have a longer discussion about vein problems, which I'm going to subdivide, because vein problems are actually probably, in my opinion, the most prevalent circulation problem there is. It's just not really discussed because it's not exciting. You don't do a whole bunch of surgical approaches initially, at least for vein problems. You try and manage them conservatively, and then you get surgical if things don't respond to conservative management. So vein problems can be most of the time diagnosed with a venous Doppler. So when we're doing these venous Dopplers, we're looking for valvular problems, but also looking for evidence of new or old DVTs or acute deep venous thrombosis. That's the kind of dangerous stuff that breaks off and goes toward your heart and lungs. Now again, most of the time when I see somebody in the clinic, they don't have this condition unless it's of sudden onset. Like, for example, I saw the other day, somebody woke up one day with their leg really swollen. Well, that's the kind of situation where I'm concerned about an acute deep venous thrombosis, but if it's a slowly progressive thing over a series of months or years, then I'm thinking more of a valvular problem with veins. So vein problems can cause leg swelling. In my experience, is probably the most common cause for swelling issues. Then there's other things like deep venous thrombosis, the dangerous stuff. Then there's other issues like medications can do it. Certainly, congestive heart failure history needs to be evaluated. So especially if you have right leg swelling, isolated right leg swelling, or significant swelling on the right side as compared to the left side. When you have congestive heart failure, the general kind of the textbook answer is you tend to swell more in your right leg than your left leg, although that's not necessarily true. So congestive heart failure is a possibility for leg swelling problems. So to kind of start recapping, vein problems, certain medications can do it, blood clots can do it, congestive heart failure can do it. Then there's esoteric things that can cause limb swelling issues, such as kidney problems, liver problems, cirrhosis of the liver, pulmonary hypertension, sometimes related to something called sleep apnea, which is uncontrolled. And sleep apnea is actually much more prevalent than you would think. And I'll talk about that in a separate discussion. And then there's this catch-all thing called lymphedema, which is, it's really kind of a diagnosis of exclusion. You can do lymphoscintigraphy, but nobody really does that. We evaluate all the other kind of reasons for limb swelling and then kind of classify everything as lymphedema if everything else turns out to be negative. And there's ways of treating that also. So I'll kind of get into the lymphedema more. There's certain signs we look for, Stemmer sign, but I'll discuss this in a separate video. But just long and short of it is, limb swelling problems are very, very common. And so they need to be evaluated because they can be quite debilitating for patients. And I think you need to find somebody who's really interested in this stuff. Unfortunately, most of these conditions kind of get blown off, I guess you'd say, because people just are not interested in working it up firmly.